Welcome to today's episode of Navigating Professionalism and Civility in Nursing. I'm your host, Nurse Eades, and we're here to discuss an essential aspect to your nursing education, and that's maintaining professionalism and then fostering a culture of civility. Now, I want to start off with saying I understand that when you join a nursing program, it becomes a new way of thinking. You're going to have to adapt to that nursing profession, and it can be overwhelming. And so, we're here to address some of your concerns and then mitigate any anxiety or frustration that you may encounter throughout your nursing program journey. So, let's start by highlighting the significance of professionalism and civility in nursing. These principles are really rooted in a lot of the code of ethics, whether it be the American Nurses Association or your personal code of ethics, but really more so your nursing associations, that emphasizes having core values, obligations, and duties of nurses when it comes to providing care to your patients that's compassionate, respectful, and ethical, not only for your patient, but also to the community. As a nursing student, we are expected to uphold these values not only within the classroom, but also in the aspect of your life. I remember as a student that I realized that in order to make those changes, because doing my own self reflection, I realized that I wasn't always I felt I was rough on the edges. So I started embodying that professionalism down to my uniform. I made sure that, like in my mindset, I'm a nurse. So I got my scrubs. I had more than three pair. I got them sent to the dry cleaners. I had them cared for. I cleaned my shoes. I watched what I said. I started role modeling my professors, role modeling other nurses that I saw in the clinical setting. And so I knew what type of individual I wanted to be. And I realized that in order to get good at this, if I was going to be doing this for 12 hours, um, a day or for 5 days a week at 8 hours a day, I had to really start embracing it and making it a part of my life, how I talk to other people. That it really leads to a lot of that importance of having your own personal integrity and acting with civility and respect for others' welfare. And that idea, that concept can't be understated. When it comes to the civility and professionalism that your nursing program may outline, it is the expected behavior of nursing students to be civil, to be professional. Your program's policy should reinforce the need for maintaining a standard of professionalism and personal conduct, not only inside but also outside the classroom. Additionally, the policy should define various forms of disruptive behavior that may occur in different learning environments, whether it be in a face to face interaction, online learning, or during your clinical experiences. The purpose of a policy is not really to bring any additional anxiety on us as students or you as a student, or to cause any frustration, but it's really there to create an inclusive, respectful, and a conducive learning environment for not just yourself, but everyone in that classroom. As a nursing student, you're really going to be held to the same high standards of professional conduct as a practicing nurse. So remember, these guidelines are in place to, one, ensure your safety, but not just your safety, two, the welfare of your patients, and then third, for the integrity of the nursing profession. So now that we've gone through a little bit of that introduction as to the purpose of civility policies and professionalism policies, I want to discuss some strategies with you that can really help you navigate your journey with confidence and with professionalism. Strategy one is about self reflection and self improvement. And that's one of the things that I said that I did. So you have to embrace that process of self reflection and identify areas in which you realize that you can improve in your conduct and interactions, and then recognize that growth is a continuous journey, and that by acknowledging those weaknesses that you identified, you can work towards becoming a better student professionally, but also eventually that professional nurse. So one of the things like I did, I had to go over my feelings about like being in a program. I really had to realize that I could no longer like lean on the old ways of doing things, because I was going to be called upon to care for individuals from infants all the way up to the elderly. And so I realized that I really needed to change how I would talk to people, how I dress, and again, making sure that I exuded that professionalism that's set for us in those standards or that code of ethics. Strategy two is seek support and guidance. If you have any concerns or questions about your policy within your program or any aspect of that education that you're receiving, make sure you don't hesitate to like seek support, whether it be from a faculty member or mentor, or even through some counseling services that may be provided on your campus. Remember, this journey is not one that you take alone. The next time you go to your class, you look around. That journey is being taken by everyone in that classroom, has been taken by everyone who chooses to continue to teach you, and has been taken by every nurse that you will work alongside throughout your clinical experience. So you're not alone. Strategy three talks about fostering positive communication. If whether you're 18 coming from high school, whether you're 60, we learn a certain way to communicate, and we've been doing it for so long that we have a tendency not to realize that when we go into this profession, it requires that we speak differently, we talk differently, that we be more accurate and clear in our communication. So in your nursing profession, with communication, it being effective is going to be essential. And you learn that in the fundamental portion. You'll also learn that as you think about the correct responses that a nurse should give a patient, or when you get into your psychiatric mental illness aspect. They talk a lot about communication there. Learning how to practice active listening. And with active listening, I want to make sure that I say that the only way to practice active listening is to be silent. Without silence, you can't hear what the other person is saying. Active listening is about being silent, taking the information that's being given to you from that individual, hearing it, processing it, and preparing a response. And so, next, after practicing active listening, you want to make sure that you're giving an empathetic response. And then make sure that you're maintaining a respectful dialogue with your peers, faculty, and patients. Positive communication cultivates a harmonious and respectful learning environment. What I see a lot of is individuals talk the way they do. If you've ever been in an experience where you're with your loved one in a hospital, if you take the time to listen to the conversations that are being had when you're disappointed in service, a lot of times you will see that how they talk to one another conveys and how they treat you or your loved one and how they talk to you or your loved one. And I think that has something to do with the fact that there's that loss of connection, that your communication, how you talk to the students in your classroom, how you talk to your instructor determines what type of nurse you're going to be. Eventually, you won't be able to hold on to it if you don't embrace it and make it a part of you. So when you're thinking about what you're saying and what you're doing, think about the environment in which you're in, the people that's around. What will people think? Because at the end of the day, you're building your own brand as a nurse. How do you want people to see you? So making sure that you communicate appropriately, um, definitely leads to that connectivity that everyone will have within the classroom. Definitely reduces anxiety and stress. Strategy 4 talks about prioritizing your health and your well-being. And I know that I have this as strategy 4. It really should be moved to 1, but I have this saying, and you'll hear me say it a lot throughout podcasting, is that you're no good to anyone if you don't take care of yourself, right? So take care of yourself. That's crucial to maintaining professionalism. As you get into this process, you begin to realize not taking care of yourself physically, giving your body the nourishment that it needs, the vitamins that it needs, the rest it needs, the water it needs, the sleep it needs, impacts how you think, impacts your mood. And so if you're anxious, you're agitated, you're aggressive, it's going to come out in how you speak. If you're frustrated, it's definitely, there's no way to hide that. And as you start to learn about poor perfusion because your body's not getting what it does or what it needs, or when your body's lacking fluid and electrolytes, the effect it has on the level of consciousness and how you think you're not thinking correctly. And so when you are off balance, physically and mentally, when it comes to your health, when you're answering questions, when you're studying, your level of consciousness is not as at its highest. So you may be remembering information incorrectly, or you may not be responding the way you should. And so even when you're communicating, how you want things to come out will not come out that way because your body just does not have the energy to want to correct itself. So just make sure that you prioritize your health and your well-being. Avoid behaviors that may impact your ability to function effectively as a nursing student. And then remember that the journey to become a professional nurse is a transformational experience. Embrace this opportunity to grow personally and professionally, and always strive to really embody the values outlined, especially in the code of ethics. Well, this ends our podcast. Thank you so much for joining me on this episode of Navigating Professionalism and Civility in Nursing. I really do hope that these insights have eased any anxiety or frustration that you might have, but also can help you in trying to reduce and prevent any anxiety and frustration in your journey in the nursing program. Remember that professionalism and civility are at the heart of nursing practice, and by upholding these principles, you contribute to the well being of your patients and the nursing community. Stay focused, stay compassionate, and stay professional. May you do well, enjoy your journey, and I'll catch up with you on our next episode.